The question is, can we extend that to other B-cell CD19 positive malignancies, for example, mantle cell lymphoma, and maybe even in CLL, and so forth. So that would be very encouraging to see if CAR T cells play a role in long-term remission. So I think we don't have long-term data. And if some of these patients who are refractory to all chemotherapy got a remission which lasted at least a year, if we follow them over time and find the disease doesn't come back, I think that would be a huge progress, something which we haven't seen for a very long time. Because these are patients who are potentially not going to be able to even benefit from a transplant because they're chemo-refractory patients. So that, I think, is something which people are eagerly waiting to see. If that begs the question that if you move CAR T therapy earlier on in the line of therapy for even chemosensitive disease, then would it play a role in how does it line up with transplant, and does it is it superior to transplant? Are we talking about a time when we may not have to transplant everyone who is transplant eligible in large cell lymphoma, and rather do CAR T cell instead? I think clinical trials are being designed to look at that question.